My name is Leila Renfroe, and I'm an occupational therapist. One of the reasons I went into occupational therapy was to develop relationships with my patients. And I thought, what a great environment, because in the PACE environment, once someone is in the program, they're with you until they pass on. It's a great opportunity to really provide care for the elderly. PACE stands for a program of all-inclusive care for the elderly. So a PACE program is a program that includes health care, which would be primary care, pharmacy, nursing. We have nurse practitioners, you have activities, social work, nutrition, and then the therapies. It's designed to take care of the individual, and their plan of care is very much individualized to what their needs are. It was early 2010 when we started noticing my dad was declining, and it was April when he actually started in the PACE program. My dad, once he entered the PACE program, really thrived, and so for 3 years he did really well. He only actually attended the program 2 days a week, but that was enough to give him that social outlet, but also provide the physician the opportunity to monitor and keep their hand on the pulse of his medical problems. It was probably April of 2013, so exactly about 3 years later, that's when my dad started to decline again. And what I did discover at that point is grieving starts not when you lose a loved one, but when you start seeing the decline. But it was also a really special time for me because I really got some quality time with my dad. Through this decline, and then eventually my dad, we had to put him in the nursing home. That was only for about 12 days until he died. PACE was there with us every step of the way. I think what it did was I always understood what caregiving was about, but because I was never a caregiver, I didn't truly understand the impact that it has in your day-to-day life. And so I think it opened my eyes more to being more understanding of caregivers and what they're going through. When we take care of our participants or we enroll someone into the program, the way we view it is we don't just take care of the participant, but we're also taking care of the caregiver and the family involved in the participant's care. You have to take care of yourself in order to take care of your loved one. Studies have shown that someone that enters a PACE program will actually live anywhere from 3 to 5 years longer than if they weren't in a PACE program. And the reason for that is because you have that day-to-day care. You have professional caregivers that get to know you so well that when there's a change in your health, in your cognitive status, they see it immediately and can intervene immediately. But after being in the program for maybe 2 to 3 months, we see this significant improvement where they are more independent, they're able to do more for themselves, and they're enjoying life again.